Hello, I am Dr. Bhavna, Chaudhari, a gynecologist. Today we are discussing more about the first prenatal visit. Patient is very conscious and confused in her first prenatal visit. Our main motive is our lady should be healthy, happy and have relaxed mind. So let us discuss about it.
Hi, Dr. Bhavna. So, today, as we are discussing prenatal counseling, my first question to you will be when should a couple visit to you? That is, before planning their conception or after missing her first period?
Very interesting and common question. I always emphasize on the most precious 1000 days of a mother and a child's life, in which the first 3 months are the preconceptional period, 9 months of a pregnancy period, and the first 2 years of baby's life, where the maximum brain development occurs. So it is a very crucial and important phase of a couple's life. So before pregnancy for 3 to 6 months, the couple should prepare themselves physically, mentally, and also spiritually.
So, doctor, the next common question or query every lady has in her mind is how will she come to know that she is pregnant and she is expecting?
So first she misses her period. If her period is regular, then after 5 days overdue, she can do her urine pregnancy test at home or in a hospital. She can also go to a doctor, and when the doctor do her vaginal examination, she will come to know that the patient is pregnant. Because in pregnancy the cervix become extremely soft and the size increases. So according to the weeks of pregnancy, the doctor will come to know how months pregnancy it is. Then the ultrasound scan is now available everywhere. So by ultrasound scan in first trimester, we know the exact dating, and the date of delivery we can also calculate by the ultrasound examination if the dates of the menstrual cycles are not regular.
Now, doctor, she knows that she is pregnant and she is expecting. So, what will be the best time to visit and what should be her next steps?
So whenever a couple visit, we first do a thorough history examination. Means we ask her some basic questions like whether the pregnancy is primary first time or the second time or what. Then we ask her about the obstetric career, whether she has previous miscarriages or previous preterm deliveries or something else. Then we ask about her family history, like whether mother or the father of the patient has some significant diseases like diabetes, hypertension, or hyperthyroidism or hypothyroidism. See, in the first 3 months, the baby cannot prepare her own thyroid hormone. So her thyroid level should be optimum. So we some tests also. So after taking the history, then we see for the general examination. We see her age, her weight, her height, whether she is obese or she is underweight. Then we also do some basic examination like blood test and urine examination. Whether she has complaint of anemia. Anemia means the deficiency of red blood cells. So if there is anemia, we have to correct it. In Asians, the thalassemia and sickle cell anemia are very common. So if she has a chronic anemia, then we also do thalassemia and sickle test anemia test. Then if she is obese, her age is more, and she has a history of diabetes as a parent, we also do HbA1c levels. If the HbA1c levels are high, have to go for a diabetologist and immediately start the treatment. If she is not pregnant, then well and good, we first correct the diabetes, her HbA1c will come down, and then only she should conceive.
So, doctor, what are the common symptoms a lady should look out for in her pregnancy period and how she should tackle them?
So first trimester is uh, very challenging for some women, because some women feel nauseating, some have vomiting also. Then they don't feel like doing anything. Weakness they feel. Then always they feel like sleepy. So why all this is happening? Because of hormonal changes. Because for continuation of pregnancy, there is one hormone called progesterone, because of which these side effects occur. Because of this progesterone hormone, the motility of the gut is disturbed, and because of that, constipation also she has to face sometimes. Sometimes she has so much vomiting that we called it as hyperemesis gravidarum. So much vomiting she has to face. She faces dehydration, and immediately she should consult the doctor, and she may need IV fluids also. So you should look for your weight. If the weight is not reducing and you can do your daily activities, then nothing to worry. 1 to 2 vomiting is okay. Nausea feeling is also okay. We doctors, when the patient says, doctor, I don't have nausea, then we get tensed, because nausea is a common symptom. So nothing to worry about it, and it will get settled after 3 months. Okay. Some ladies may have PV bleeding, so bleeding is not a common symptom. So they may have a mild spotting at the time of implantation, that is okay. But after that, if she is complaining of bleeding, then always you should do her ultrasound examination and check what is the problem. Then little cramps are also common, but if the pain is more and the gestational sac is not seen in the uterus by ultrasonography, then what we call is ectopic pregnancy. That is, the pregnancy grow in the fallopian tube, and it's an emergency and it should immediately get tackled. So for n number of reasons, she should consult the doctor and get the advice. Some women may have heaviness in the breast or breast tenderness also. Some have mood swings. Some have food cravings, because some like khatta khane ka man kar raha hai. So it is also very normal. But you should understand that you must avoid the junk food and go for better nutritious options. Some may have complaint of frequency of urination. So that is because the bladder and the uterus both are in close proximity with each other. So till 3 months, uterus is a pelvic organ. After 4 months, as it grow in abdomen, the frequency of the urination reduces. So it is also a normal symptom. Nothing to worry about.
So, doctor, is it safe for a pregnant lady to have a dental treatment done during her pregnancy period?
This is also a very common question. So I always advise, if there is a major dental problem, she should solve it before getting pregnant. Or if some emergency occurs, then for the first 3 months and the last 3 months, she should avoid the tooth extraction and all. Temporary treatment she can do, and after completing 3.5 months, she should go for root canal or major surgery.
So now, as we see the trend setting of baby moon is very high, what will be your travel guidelines for all those couples who want to travel in the pregnancy period?
So in the first 3 months, she must avoid traveling two-wheeler or four-wheeler. If there is an emergency, she can travel by train. But I must say, two-wheeler is completely, she should stop driving two-wheelers, and as much as possible, she should avoid traveling.
So that's great. But there's one more common question that every couple have in their mind is during the pregnancy period, how they should maintain their physical relationships.
Ideally, she should avoid the physical relations, because the part of the uterus we call as cervix, it's become very soft, and if the placenta is low lying, then she may has to face bleeding, or sometimes she has to face some infections. So ideally, in the first 3 months, we ask the couple to maintain the abstinence.
So in today's lifestyle, where everyone have this tendencies of eating out on weekends and everything like that, how should one maintain their food habits in their pregnancy period?
That the most awaited question it was. I like to speak on that, because whenever we eat outside or we eat packaged food or preserved food, they contain lot of preservative, and they are very toxic, and you may say harmful for the growing fetus, because the most of the brain development occurred in first 3 months of life. So you should have a fresh homemade food, which be high in carbohydrate, because the patient feel nauseating, she feel giddy. So more carbs, which should be homemade, and it should be less spicy. So you should add seasonal fruits and salads. Lots of salads you have. Then you can have 5 to 6 soaked almonds. Then 2 to 4 dates you can take. Be hydrated. So you should have 8 to 10 glasses of water daily. So most of the women don't like that bland water. So you can go for a sweetened buttermilk. Then you can have coconut water. Tea and coffee you should avoid as much as possible, because they are very acidic, and pregnancy itself is a acidic condition. So you should have small frequent diet, 2 to 3 hourly, which should be nutritious, high in carbs and less spicy.
Okay, so that was amazing, doctor. Anything else you would like to emphasize on that we should remember?
A few more tips I want to add on. You must avoid the self medication. You should not take over the counter drugs for headache and for cough and cold. You can consult your doctor and then only you should take medicine. If you have some problems like you have history of epilepsy or you have asthma or if you have hypertension, then if you are already on some medication, then there are some drugs which are very very harmful for the baby, so you should change the drugs and then only after consultation of doctor you should continue the medicine. Then one more point I would like to add is you should avoid the x-rays. um, it also can be harmful in the first trimester.
So, doctor, other than maintaining daily diet and everything, what should a lady take in form of supplements?
Taking folic acid in the first trimester and ideally before conception is very very important. Folic acid and vitamin B12 and biotin are few vitamins which are important, which can avoid major complications like anomalies in the baby. As soon as you know you are planning, or if not then you are pregnant, you should start folic acid, vitamin B12 and biotin. Omega fatty acid you can have, but most of the females have a lot of nausea, so you can balance it by taking food supplements like walnuts and flax seeds and small amounts of nuts like soak almonds and cashews. They will take care of the omega supplements. So today's take home message for the couples are: become aware about your lifestyle, your food habits, and become aware about your baby's physical, mental, and spiritual development, and start following the tips. And please post in the comment box. And don't forget to follow and subscribe our channel.